Hi there, I'm Jessica Glass, doctoral candidate at Pennsylvania Western University. Today I will present my literature review, Preventing and Managing Chronic Low Back and Neck Musculoskeletal Pain Through Integrative Health in Military Populations. First, we will look at musculoskeletal chronic pain in military populations, including the characteristics of this condition and any and all associated risk factors. Next, we will discuss preventive and management strategies through physical approaches and then mind-to-body approaches. The problem is the daily occupational activity and training performed within the U.S. military are limited with strategies on preventing musculoskeletal injuries and management strategies once chronic pain of the musculoskeletal system occurs. The purpose of this literature review and presentation is to provide the framework on chronic pain and evidence-based non-pharmacological whole health strategies for prevention and management of chronic pain within all military populations, including active duty, reservists and National Guard, veterans, and their support personnel. Throughout this review, I will be discussing musculoskeletal chronic pain of the low back and neck regions, but state chronic pain for a simpler term. First, I want to discuss musculoskeletal chronic pain in military populations. In theory, when someone becomes injured and lacks sufficient rehabilitation, the kinetic chain may further deteriorate, which may not only limit the current issue while increasing their pain, but may also increase the risk of other injuries to the musculoskeletal system. The traditional rehabilitative strategies within the military after this issue occurs is a service member may seek medical attention and traditionally will receive a profile, which are doctor's orders of the limitation they must abide by, and an opioid and/or ibuprofen prescription. If and when the pain has lasted more than 3 months after initial injury, chronic pain has resulted. If the pain continues and function cannot be maintained, then the service member may either be medically discharged from the military, or after discharging from the military, they may seek disability. This poses multiple issues within the ranks. First, for service members who seek professional help, they may face criticism and possible medical discharge. With this being a potential threat, many service members will not even seek professional help, further increasing their injury and disability. And second, for those who discharge, may seek disability, increasing theirs and the government's financial burden and the need for veteran affairs resources. Next, I want to explain the characteristics of musculoskeletal chronic pain in the neck and low back regions. Musculoskeletal chronic pain is a common medical condition ranging from mild discomfort to severe and debilitating pain lasting more than 3 months and may be caused by multiple factors, including injury, illness, and posture. Chronic low back pain is the most common musculoskeletal disorder in North America, with chronic neck pain next in line. These statistics align with the military population as well. Chronic low back pain consists of pathology pain such as trauma, tumors, infection, or inflammatory processes, degenerative alterations in disc, facet joints, and/or ligaments. Chronic neck pain consists of postural or mechanical stress. Now we will explore the evidence on potential risk factors. Farley et al. 2024 explains healthcare professionals must first identify all anatomical structures included, any dysfunction, and any risk factors contributing to patients' symptoms to diagnose and guide their treatment. Guan et al. 2024 conducted a systematic review and meta-analysis to determine if there are any associations between low back pain and lifestyle factors, including body mass index, insomnia, smoking and alcohol consumption, physical inactivity, occupational hazards, and psychological factors. The results concluded positive causal effects for BMI, insomnia, smoking and alcohol consumption, and leisurely sedentary behaviors. However, waist circumference, major depressive disorders, and physical activity lack conclusive evidence for causality in all back pain outcomes. To further understand the merit of these results, Tu et al. 2021 also conducted a systematic review examining potential risk factors. The results aligned with the research performed from Guan et al. 2024. However, further risk factors were shown, including an increase for women and a few occupational risk factors, such as any lower-ranking military personnel, enduring a blast injury, and job duties that included consistently lifting more than 30 pounds and/or wearing body armor consistently. Both research articles suggest clinicians and other healthcare professionals should integrate these factors into their assessments for evaluation and tailor the interventions accordingly. Moreover, military personnel should review their lifestyle habits and make any necessary adjustments, including weight management and smoking cessation. Active duty service members perform physical activity as an occupational responsibility. However, depending on the branch, the roles and responsibility of the specific occupation, and other factors may limit optimal physical behaviors and must be examined to determine if it's a potential risk factor for chronic pain. For all other military personnel, physical activity is based on a number of factors and should also be reviewed to prevent this condition from occurring. Atkins and Boner 2022 state, for many veterans, musculoskeletal pain and treatment with opioids may have their roots in active duty service, where training and combat-related injuries are common, causing pain, disability, and reduced quality of life during and active after service. Mirjuk et al. 2020 conducted a randomized controlled trial to compare if and what adverse outcomes occurred between veterans with chronic pain using non-pharmacological treatment methods to those who were provided with pharmacological treatments for their chronic pain during their service, since opioid prescriptions, especially at higher doses and/or longer durations of use, has been associated with an increased risk for adverse outcomes. The findings concluded that alcohol and/or drug disorders were the most frequent adverse outcomes, and for the veterans who were treated with non-pharmacological methods were at significantly lower risk for developing these consequences. The researchers suggest if non-pharmacological treatment is used to manage chronic pain, in addition to or instead of opioids, this may not only influence pain and functional status, but also on the adverse outcomes that are associated with chronic pain and opioid use. Yushia et al. 2022 explains, the effects of chronic pain and the opioid crisis have fueled interest in the use of complementary and integrative health modalities and chronic pain management. Now that we have reviewed what musculoskeletal chronic pain is and how it relates to the military populations, the characteristics and associated risk factors, I will provide you with the evidence on preventive and management strategies through physical approaches. Integrative health is an approach that will combine one or more conventional healthcare methods like physical therapy and/or psychotherapy in combination with a complementary health approach like physical activity and mindfulness to treat the whole person rather than one specific organ system. We will discuss multiple types of manual therapies, physical activities, and mobility training to gather multiple physical approaches for musculoskeletal chronic pain prevention and management. The following suggestions may be used to decrease one's risk of developing chronic pain while managing any current chronic pain conditions to alleviate pain and disability while increasing one's function and optimal living. First, I would like to discuss manual therapies. Manual therapies are a type of physical therapy involving a self-led or therapist-led technique using hands or tools aiming to improve one's pain, flexibility, mobility, and range of motion. There are many different techniques and tools used by certified therapists and other healthcare professionals, but the main techniques that I will discuss found throughout current literature are active release and strain counter-strain techniques and clinical massage. The self-led therapy I will discuss is foam rolling, which is a well-known and popular method used. Here I have provided you with some of the literature on manual therapies. Kang and Yim 2023 compared the effects of physical therapy with clinical massage with active release technique, clinical massage with the SCS technique, and clinical massage alone in patients with chronic neck pain on pain, disability, and pressure pain threshold. The findings concluded all three groups showed statistically significant improvements in all outcome measurements. Moreover, the ART with clinical massage group had the highest decrease for both pain and neck disability, whereas the SCS technique with clinical massage group had the largest increase for pressure pain threshold. To further explore the research on the SCS technique as it relates to pain and disability, He, Yamini et al. 2024 compared the effects of the SCS technique and the SCS technique with core strengthening exercises on individuals with chronic low back pain. The findings concluded that the core strengthening exercises with the SCS technique intervention had statistically significant improvements in all outcome measurements. These research articles suggest complementing current chronic pain management interventions with any or all of these integrative therapies may help enhance these individuals' quality of living. Incorporating clinical massage with ART and/or core strengthening exercises with the SCS technique were shown to be the most effective within these articles. Next, I will provide the literature on self-led foam rolling therapy. The main benefits of foam rolling found in the literature includes enhancing performance, reducing muscle soreness, improving recovery, preventing injuries, increasing range of motion, vertical jump and flexibility, and enhancing one's neuromuscular function. The current research on foam rolling has been mostly investigated on the athletic population, which tends to align with the military population. Santos et al. 2024 published a systematic review exploring and analyzing the literature on the effects of foam rolling on pain intensity in individuals with chronic and acute musculoskeletal pain. There's multiple research articles cited in this systematic review to show the benefits of foam rolling, but this systematic review did not find statistically significant evidence for foam rolling on pain intensities in these individuals. Even though the systematic review did not find foam rolling to be beneficial for reducing pain intensities, research has shown multiple benefits of this therapeutic technique. Therefore, incorporating foam rolling into one's routine may benefit the individual's overall musculoskeletal system while preventing injury to further reduce the risk of developing chronic pain. The next physical approach I would like to discuss is physical activity, which is an integrative way to increase muscular strength, endurance, and cardiovascular health through various activities to move the body. Physical activity is used by physical therapists and other exercise health professionals to manage many health conditions, including chronic pain, and may involve strength training, mobility, aerobic activity, yoga, gardening, and any other activity involving movement of the body to reap its rewards. After intensive movement is performed, the next appropriate step would be recovery. A few recovery or stretching techniques discussed in this review will be self-stretching exercise and motor control exercise. Here I have provided you with some of the literature on physical activity for individuals with chronic pain. Fernandez-Rodriguez et al. 2022 sought to determine the best exercise for pain and disability by publishing a network meta-analysis to evaluate the literature on the effectiveness of exercise for reducing pain and disability in individuals with chronic low back pain. The interventions used for comparison were aerobic exercise, strength exercise, combined exercise, core-based, McKenzie exercises, stretching, mind-body exercises, Pilates, and a control group which consisted of no exercise. The findings concluded Pilates was the most effective intervention for reducing both pain and disability. Moreover, mind-body exercises and core-based exercises followed for pain outcomes, and strength and core-based exercises followed for disability outcomes. Therefore, as you may see, core-based exercises follows Pilates to provide both pain and disability outcomes. The research suggests integrating Pilates and/or core-based exercises to enhance these individuals' quality of life through reducing their pain and disability. Zhang et al. 2024 in a randomized controlled trial found cervical extensor exercise was far more beneficial than the cervical extensor stretching exercise. The results suggest strengthening specific locations around the chronic pain site, such as the muscles surrounding the neck and low back regions, and the core muscles may be beneficial for pain, disability, and range of motion. When an individual performs strengthening exercises or intensive movements, recovery, such as stretching, would be the appropriate next step for chronic pain management and prevention as well as any individual. Turkey et al. 2023 sought to compare the effects of self-stretching exercises and motor control exercises on pain intensity, disability, and other secondary factors, including fear avoidance, global perceived effects, and the fingertip to floor test measurements in individuals with chronic low back pain. The findings concluded both of these interventions were equally effective. The suggestions would include to use a therapist or subject's preference since either strategy may be used. The last physical approach for preventing and managing chronic pain I would like to discuss is mobility training. There are multiple types of mobility training such as motor control retraining exercise, neuromuscular exercise, and stabilization exercises. Mobility training naturally slows our active movements down, facilitating the recovery process. Sabania et al. 2024 investigated the effects of motor control retraining exercises on pain, functional disability, and range of motion on military personnel with chronic low back pain. The findings concluded motor control exercises following conventional therapies significantly improved all outcomes. As explained earlier in the stretching section of this presentation, Turkey et al. 2023 concluded both self-stretching exercises and motor control exercises were equally effective. Since motor control exercises integrate specific exercises along with stretching movements, it is suggested to incorporate this method, motor control exercises, after intensive movement for a more efficient way to reap the benefits of stretching and recovery while minimizing pain and disability in these individuals. Other types of mobility training include neuromuscular exercise and stabilization exercises. These types of mobility training also slows down movement and provides recovery as well, but may be more active than the motor control or stretching activities explained earlier. Alvania et al. 2021 investigated neuromuscular exercises, and Salik et al. 2020 investigated stabilization exercises on multiple outcomes, including pain and disability in individuals with chronic pain. Both found the interventions to be statistically significant for both pain and disability. Therefore, it is recommended to incorporate mobility training into one's chronic pain management and prevention interventions. It is also suggested to perform such exercises after physical activity, but prior to completing one session, since these activities may be a little bit more active than typical recovery methods. So now that you're aware of multiple physical approaches that may be implemented into an integrative health prevention and management plan for such individuals, I will now provide you with the evidence on additional strategies through mind and body approaches. First, the U.S. Department of Health and Human Services 2024 defines whole person health as an approach to helping individuals improve and restore their health in multiple domains, including but not limited to biological, behavioral, and social components. To further benefit these individuals by using a whole person health approach to their healthcare, we will discuss pain education, mindfulness, and cognitive therapies. The following suggestions may be used to decrease one's risk of developing chronic pain while alleviating any current pain and disability, but may additionally enhance their quality of life through an interconnectedness of a mind and body approach. First, I would like to discuss pain education. Pain education educates the individual on neurobiology and neurophysiology of pain while focusing on the uniqueness and singular variances of the overall pain experience. Pain education consists of defining and understanding what pain is and how it is processed within the body, and then learning how to manage the condition while preventing further damage. Rabiati et al. 2024 investigated the effects of pain neuroscience education, motor control exercises, and group-based exercise in individuals with chronic low back pain. The findings concluded the interventions were statistically significant in improving all outcomes, which was pain intensity, disability, fear avoidance, and self-efficacy. Rosine et al. 2023 conducted a study comparing yoga and pain education on relieving pain and disability in individuals with chronic pain and found no significant difference between the two. Therefore, recommended incorporating these methods into a chronic pain prevention and management plan may be beneficial. This presentation has already provided the benefits of MCE, but Rabii et al. Results not only supports MCE, but highlights the benefits of pain education and group-based exercise. Since most physical activity performed in the military is group-based, it is recommended to continue training in this manner. For those medically discharged, a veteran, or military personnel not performing physical activity in a group-based setting, it may be beneficial to do so. The next mind and body approach I would like to discuss is mindfulness. Mindfulness is when an individual purposely focuses on the present moment and can be performed anywhere and anytime and may be performed through mindfulness-based meditation, reflective journaling, or cognitive functional therapy. Research has shown mindfulness affects the psychological health of participating individuals and may improve the quality of life for individuals experiencing chronic pain. That is stated by Paul et al. 2023. Therefore, performing mindfulness is highly beneficial for the military population for the psychological benefits and for the military population with chronic pain, since this practice may improve one's quality of life through their psychological health and physical musculoskeletal health. In a qualitative research study, Grafrida et al. 2023 found common themes among the subjects. For subjects who participated in the continuous practices of mindfulness-based meditation and reflective journaling outside the sessions, they obtained the most benefits within their chronic pain experiences. Now, to determine the quantitative effects of mindfulness, Pal et al. 2023 concluded the subjects in the mindfulness intervention showed statistically significant decreases in pain intensity and other factors typically found in this population, including catastrophizing and kinesiophobia. Agyun et al. 2024 explored the baseline differences between healthy controls and chronic pain patients regarding psychological and biological markers, which included significantly lower scores in various health and well-being parameters, while demonstrating higher scores in depression and pain catastrophizing and significantly higher cytokine levels, which shows the presence of inflammation meant to fight off infection or injury. These findings highlight the psychological distress experienced by individuals with chronic pain. Therefore, incorporating mindfulness into one's chronic pain management and preventive plan may benefit the psychological and physiological factors. The last mind and body approach for preventing and managing chronic pain I would like to discuss is cognitive therapies. Cognitive therapies include multiple types of therapies with a focus on introducing behavioral changes to alter one's mindset about a traumatic experience or negative behavior. Cognitive functional therapy is a cognitive therapy that consists of focusing on pain management by addressing the psychological factors with the intention to alter negative thoughts or poor habits while incorporating a functional component such as a relaxation technique. Individuals with chronic pain tend to develop negative behaviors such as kinesiophobia, also known as a fear of movement, which typically develops from a painful experience and is transferred by the individual's perception of a continuous painful injury or re-injury if movement occurs. Askapura and Yalfini 2024 investigated CFT on reducing pain, disability, and kinesiophobia in individuals experiencing chronic low back pain. The subjects perform a cognitive component followed by control exposure through performing specific exercises, exposing the individual to fear or avoided movements in a controlled setting, and then perform a functional exercise. The researchers concluded CFT has significant effects on reducing all outcomes. Now let's summarize the literature on the physical approaches reviewed in this presentation. All therapist-led manual therapies are highly recommended for pain and disability, with the active release technique with clinical massage having the highest decrease for both pain and disability in individuals with chronic pain. Current literature on self-led foam rolling therapy has been shown to be beneficial for overall musculoskeletal health, but there was no statistically significant improvements found for pain and disability in individuals with chronic pain. The most effective form of physical activity for improvement of pain and disability for these individuals is Pilates, followed by core-based exercises, mind-body exercises, and strengthening exercises. When an individual performs any physical activity, recovery, such as stretching, would be the appropriate next step. Both self-stretching exercises and motor control exercises are equally effective. All methods of mobility training are highly recommended to incorporate into one's chronic pain management and preventive interventions. Both SSE and MCE are very similar, with both requiring slow movements and is recommended to perform after intensive activity. However, motor control exercises may be more efficient since one may obtain the benefits of both methods. Both neuromuscular exercise and stabilization exercises were found to be statistically significant for both pain and disability in this population. These methods require more physical movements than SSE and MCE, therefore it is recommended to perform after physical activity, but prior to final stretching or recovery. Now let's summarize the literature on the mind and body approaches reviewed in this presentation. Pain education is highly beneficial for preventive and management methods of chronic pain and consists of defining and understanding the whole chronic pain experience from what it is and how it is processed within the body. Integrating pain education, MCE, and yoga may enhance the overall quality of living for this population. Military personnel tend to train in group-based settings and is recommended to continue doing so. Baseline differences between individuals with chronic pain and healthy controls were discussed to highlight the psychological distress experienced by individuals with chronic pain. Mindfulness significantly decreased pain intensity, catastrophizing, and kinesiophobia in subjects with chronic pain and was shown to significantly lower scores in various health and well-being parameters, including depression and inflammation. Cognitive functional therapy is a cognitive therapeutic method used for pain management and has significant effects on reducing pain, disability, and kinesiophobia. Improving America's military personnel by preventing chronic pain and managing it once developed through integrative, non-pharmacological interventions are the main goal and focus of this literature review and presentation. Individuals experiencing chronic pain have increased pain and disabilities and decreased functional health, which can increase financial and emotional burdens on the individual, military community, and society. Opioid prescription misuse and abuse, medical discharge, and disability rates consistently rising shows that a change must be made. Evidence-based preventive and management chronic pain interventions are needed. Therefore, this review provides current evidence on multiple strategies, including physical and mind and body approaches for a whole health integrative approach. Manual therapies to enhance recovery with the active lifestyle these individuals endure. Conducting appropriate physical activity for performance enhancement and injury prevention will ensure our service members minimize their risk of developing an injury which could result into chronic pain. And mobility training to increase functional health and minimize injury risk. For mind and body approaches, we discuss pain education, mindfulness, and cognitive therapies. Educating these individuals on pain will provide awareness for prevention and management if already developed. Mindfulness is not only beneficial for chronic pain, but overall quality of life. And cognitive therapy to minimize any pain while changing one's negative behaviors such as fear of movement, which can turn an acute injury into a chronic one. References included in this presentation have been provided for you on the following slides. However, if you have any questions, please feel free to contact me at the email provided. Thank you for your time.